Medicare, it is the government health care you're entitled to, but it's also a little complicated. So it's important to know your options and when you can actually start getting covered. That's why we have Catherine Sevier from the Generation Study Group and AARP and Steve Edmonds from Alliance Insurance Services with us today. They can answer your questions about Medicare, how to enroll, what the different plans mean, and all of that jazz, plus more. So what we want you to do is we want you to text your questions to our experts. This is your chance to ask whatever question you want, 336-379-5775, and you will get your answer in real time. But we're going to go over some of those frequently asked questions first and foremost. All right, the first question is, when do I have to sign up for Medicare? And there is a specific answer. So Catherine, start us off.
Well, so the specific answer is that as you approach your 65th birthday, this should be your priority. 3 months before your birthday, the month of your birthday, or the 3 months afterward. If you don't sign up then you put yourself at risk for paying a penalty for the rest of your life and not getting insured when you need it. So you could not only have a gap in your insurance, but be paying a higher premium.
Okay, so what I want to do is I want to bring that graphic that we just had up again, because there's that fine print at the bottom, and I want to make sure everybody sees that. You heard her say the 3 months before or after your 64th birthday, but then you heard her talk about that penalty, and it says you will face a 10% penalty every single year for your lifetime if you do not sign up on time. And that is for reals, like that actually happens.
Indeed.
Indeed. Okay, so we wanted to make sure that we brought that up and that we showed you that for sure. Now, when you look at Medicare, you know, people say, oh yeah, it covers this, 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 and this, but there are different plans for Medicare and they each cover something different. So Steve, let's go over the different Medicare plans, just kind of like the highlighting the big ones there.
Okay, so basically with your Medicare coverage, you're going to, from Medicare, you're going to get your Part A, which is your hospital benefits, and then you're going to get your Part B, which is your medical benefits. And and then most of the time, people are going to be better off to go with some type of insurance coverage to help supplement that, because, you know, Medicare is not going to cover 100% of your medical cost, and a lot of times it's only 80%. So you need a good insurance plan there that'll help fill in those gaps where you're not left paying a tremendous out-of-pocket cost if you were to have like a major health condition that pops up. Another thing worth mentioning really is Part D, which is your prescription drug coverage, and Medicare does not cover that. So that's another thing that you have to really have in your head to get signed up for as your 65th birthday approaches.
Okay, so we're taking a look at it right now so everybody can really look at it. So Part A covers the inpatient hospital stays. Part B covers your doctor visits. Part D is what's covering your prescriptions. And so then we have something called the Medigap. That's the extra insurance that you buy to cover co-pays, deductibles, travel. And this Medigap, something that you can, it can be whatever insurance. It can be Blue Cross Blue Shield, it can be United, it can be whatever.
Right. And there's several carriers out there, as you just mentioned, and most all of these plans are identical because there is government guidelines that these plans have to cover the same things. So most of these plans will cover essentially the same things. There are several of them. Some's a little richer than coverage than another. Some are more expensive than others. But all the Medigap plans, a lot of them really give outstanding coverage options, and it's a good way to go is a Medigap plan. Also, there's Medicare Advantage plans too that we can talk about. This day and age, a lot of people go with those, especially people that are on a tighter budget or people that maybe have a lot of health issues as far as getting some Medicaid help and stuff like that. So Medicare Advantage plans are big. They're big plans now too, probably even more so than the Medigap plans, but Medigap is the better plan, absolutely.
Medigap is the better plan, but the Medicare Advantage is a Medigap type of insurance that you can get?
It sort of is. A Medigap plan is a contract between the insurance company and Medicare. And so actually the health insurance company is handling all the claims and the benefits for a beneficiary that signs up to go that way. The downside to a Medicare Advantage plan is always going to be the out-of-pocket maximum. You have to really be careful and check those out-of-pocket maximums, because some of these Medicare Advantage plans have hefty out-of-pocket maximums. So you want to be careful with some of those.
All right. And so, Catherine, sometimes we just need to ask questions, right? And we need to ask questions one-on-one. And AARP has a tool that kind of helps with that.
They do. And we have a really good website that has a whole focus on Medicare, and it's aarp.org, and then you put in Medicare and you get to there all of the what is Medicare and how do you understand it. The other place that you can get some really good information is our state government has a program called SHIP. And if you go to our Department of Insurance, DOI.gov, and put in SHIP, SHIIP, Senior Health Insurance Plan, 2 I's though, and they have information as well, and they give you some really good basics about it.
Okay, so what we're going to do is we're going to start tackling your questions that we've got now by text. We're also going to explain Medicare Part B and why you need to sign up for it even if you're working, and why you defer it. We're going to talk about that when we come back.